As we delve into the modern era of digital dentistry, iTero intraoral scanners play a pivotal role in enhancing the efficiency of general dental practice and improving patient outcomes. Let's walk you through how iTero's tools and features help to facilitate a seamless restorative treatment workflow, potentially enhancing efficiencies and reap the benefits of streamlining your workflow in a digital way. Many doctors often view intraoral scanners merely as replacements for previous impressions. But this perspective only reveals the tip of the iceberg. Intraoral scanners offer so much more. Today, they play an active role in patient education and conversion, streamline lab communication, aid in interproximal caries diagnostics and oral health monitoring, and chairside workflows. Intraoral scanners are the gateway to a modern digital practice, connecting seamlessly with patient management systems, CAD software, and other essential digital tools. iTero intraoral scanners excel in features and connectivity, offering an ecosystem that can grow with you as your skills and needs evolve. Let's start with how digital workflows can enhance patient outcomes and practice efficiency. Let's start with patient welfare, as it is at the core of everything dentists do. Research has shown that intraoral scanning is faster than conventional impressions and significantly more comfortable for patients. A recent meta-analysis analyzed 11 studies on patient-reported outcomes and concluded that intraoral scanners can improve the patient experience and comfort. We are in an age when patients actively seek something better, more efficient, and less invasive, and the digital dental experience is increasingly sought after. The same meta-analysis also evaluated the treatment time for different types of restorations. The results demonstrated that intraoral scanner was faster overall than conventional impressions, independent of whether quadrant or complete arch scanning was utilized, regardless of the nature of the restoration. Other benefits of digital workflows include digital smile design and easier access to guided preparation techniques, which can allow for more conservative preparation design and less tooth structure removal. Now let's compare conventional workflows with digital workflows. For instance, digital impression taking using intraoral scanners significantly reduces chair time in implant and tooth-supported restorations. Let's review the evidence from a recent study by Sequeira et al. The conventional previous impression workflow for dental implant restorations is lengthy and involves multiple steps: preparing custom trays, mixing materials, taking the impression, disinfection, and shipping to the laboratory. Intraoral scanners simplify these procedures by eliminating many of these steps, allowing dentists to streamline workflows while maintaining accuracy. This study by Sequeira et al. That compares conventional impression workflows with digital intraoral scanning highlight that the conventional approach involves more steps, making digital workflows more efficient. Similarly, digital workflows significantly enhance restorative procedures for tooth-supported restorations. Conventional impressions can be time-consuming and uncomfortable for patients, according to a systematic review by Rafael Sequeira et al. Intraoral scanning is faster than previous impressions, independent of whether a quadrant or complete arch scan is conducted. Intraoral scanning not only provides reliable prosthodontic outcomes, but also improves the patient experience measured by overall preference and comfort. Patients reported less shortness of breath, less fear of repeating the impression, and fewer feelings of helplessness during the procedure when intraoral scanner was used. As we continue, we'll see that digital workflows don't just benefit the patient, but also the practice. According to a recent study, digital restorative workflows using iTero scanners for single implant crowns are 39.2% faster compared to conventional methods. This efficiency stems primarily from data acquisition and lab processes, improving the overall productivity of the practice. So far, we've talked about patient outcomes and efficiency. Next, we'll go into greater detail about the key features of intraoral scanners. It is critical to produce an accurate digital impression, as its quality directly influences the fit of restorations produced by the laboratory. The way the accuracy of the intraoral scanner is determined is by analyzing the trueness, which refers to as how closely the digital measurements reflect the actual physical dimensions they are intended to represent. It indicates how close the scanner's output is to the real-world shape and size of the scanned object and precision of the digital impression, which refers to the consistency of repeated measurements. If you scan an object multiple times, precision reflects how similar these repeated scans are to each other. It's a measure of the scanner's ability to produce the same results under the same conditions. Both trueness and precision are important to achieve an accurate digital impression. According to a recent study comparing 12 intraoral scanners found that the iTero Element 5D scanner had the best overall trueness, with a mean error of only 16.1 microns. This means the scanner captures highly accurate impressions, which is essential for ensuring that restorations fit precisely and function as intended. Further research from Casa et al. Shows that iTero also leads in overall accuracy compared to other scanners. This is depicted on the color map, where red or blue colors on the overlaid scans demonstrate deviations across multiple scan sessions. The iTero scans show almost no deviations, as depicted in the solid green color. The consistency and reliability of the iTero scanner make it the top choice for accurate, successful implant restorations across both simple and complex cases. We will now explore intraoral scanners' everyday applications in restorative treatments. To recap, we've seen the benefits of digital workflows, such as improved processes, treatment outcomes, and superior accuracy. Now, let's shift to how iTero scanners can improve the work for you in your daily practice. iTero features a pre-treatment scan option that lets you capture initial tooth anatomy and jaw relations before prepping the teeth. Later, both scans will be shared with your lab simultaneously, eliminating the need to input several orders or take separate scans. Seeing original tooth anatomy could be very useful for your laboratory, as it gives them the ability to use initial scans for temporary crowns and final restorations, preserving the patient's original anatomy. In the SOCAD software footage on the right, you see an example of using original tooth anatomy and virtual tooth extraction to prepare eggshell temporary crowns before tooth preparation. It could also be helpful to capture jaw relation with this feature, as it might get more challenging with multiple prepared teeth. With iTero, you can also capture high-definition scans of the specific teeth, like the upper central incisors in this case. The high-definition scans provide a higher resolution view of the prep areas, help to ensure all important details are captured. Reviewing the model in stone mode provides you with detailed views of margins and preparation details, which is critical for ensuring accurate restoration production by your laboratory or for yourself if you follow the chairside workflow. Another helpful tool is the occlusogram. It allows you to check occlusal clearance, distance between the prep and the opposing arch, directly on the scan during the preparation process, ensuring that there's sufficient space for the final restoration material. In this example, the prepared tooth number 41 shows enough occlusal clearance for the restoration with the iTero occlusogram tool enabled. If the occlusogram shows insufficient space, the eraser tool allows you to selectively remove parts of the scan. Once the preparation is complete, it's essential to define the margin lines clearly. iTero's margin marking tools help you communicate the precise details to your laboratory technicians, ensuring they understand exactly where the margin is for an optimal fit in the final restoration. The near-infrared imaging, NIRI, and intraoral camera integrated into iTero scanners offer an aid tool to detect interproximal caries. The iTero near-infrared imaging causes interference in enamel to appear white, while intact enamel appears darker. iTero NIRI technology performance was proven in a clinical study for interproximal caries detections with the largest amount of analyzed data conducted in a real-world setting. In this study, iTero NIRI technology demonstrated 96% accuracy in detecting dentinal interproximal caries when compared to bite-wing X-ray. iTero NIRI technology also showed 66% greater sensitivity than bite-wing X-ray in interproximal lesion detection, when compared to the clinical evaluation of posterior interproximal lesions observed during caries debridement. Lastly, let's examine how practice and lab synergy enabled by iTero scanners can elevate your work. iTero's digital workflow allows seamless communication between a dentist and a laboratory. High-resolution scans, knee and intraoral camera images also get transferred to your technician's exocad workstations. This helps in accurate ceramic layering of highly aesthetic restorations. External pictures and videos could be sent directly from the iTero portal to the laboratory. This additional data can help dental technicians to design better fitting and more aesthetic restorations. The direct-to-lab workflow saves you and your lab time and eliminates the headaches of multiple communication channels by consolidating all patient-related data on a single platform. In conclusion, digital workflows using the iTero intraoral scanners offer numerous benefits, from improved patient comfort to increased practice efficiency. With scientifically proven accuracy, simplified workflows, and better lab communication, integrating digital scanners with iTero can significantly enhance your practice efficiency and patient outcome. It starts with iTero.